Hello, everyone. We as Group 7 are going to present the theory of health as an expanding consciousness by Margaret and Newman, our case scenario, and how we applied the theory in nursing practice. The members of Group 7 are Loveleen Madino, Mandeep Kaur, Navdeep Kaur, Preeti Gill, and Thea Pabokan. My name is Navdeep Kaur, and I will be introducing Margaret and Newman and her theory. First of all, Margaret and Newman. She was an American nurse, nursing theorist, and a university professor. She was born on October 10, 1933 in Tennessee, United States. Newman earned her bachelor's degree in home economics and English, her second bachelor's degree in nursing, and a master's degree in medical surgical nursing. She earned her PhD in nursing science and rehabilitation nursing. She learned that one can be healthy in the time of disease while taking care of her mother who had ALS. She authored the theory of health as expanding consciousness, which was influenced by her mentor and one of the earlier theorists, Martha E. Rogers. She advanced the knowledge of nursing discipline, and on December 18, 2018, Margaret and Newman passed over to the great beyond. Introduction of the theory. Newman published the theory in 1947, and according to her, the focus of the theory is on health as the expansion of consciousness, and the goal of nursing is to assist people to utilize the power that is within them as they evolve towards higher level of consciousness. According to Newman, consciousness is cognitive and affective awareness and interconnectedness with the environment. And definition of health is the outcome of interaction with the environment. Description of the theory and its application in nursing. There is a picture about interaction between nurse and a client in which they comes together and moves apart through the process of recognition, insight, and transformation. According to Endo 2017, human beings as unitary and health and disease are inseparable from each other. The manifestation of disease depends on the pattern of the individual. So the pathology of the disease exists before the symptoms appear. The nurse helps to understand people to use the power that is within them to develop a higher level of consciousness. And this process helps to realize the disease process, its recovery, and its prevention. Nurses help clients get in touch with the meaning of life by identifying their health patterns. Health as expanding consciousness is not only focused on treating the disease, but also helps to understand the patient's pattern of interacting with their environment and how to move forward after that. It helps to recognize the life pattern of the individual as well as their community. Strengths and weaknesses of the Newman's theory. According to Current Nursing 2014, strengths of the theory is that it can be applied in any setting to generate nursing interventions. And the weaknesses of the theory is that there was a very little discussion on the environment, and the theory was abstract, and the research that has been conducted was only qualitative. And the last weakness is that variables used in the theory are difficult to define. Now Thea will present the next part. Thank you.
Hello, everyone. This is Thea Pabokan, and I'll be discussing the concepts, philosophical underpinnings, and assumptions on Newman's view on patterns. Now let's proceed. According to Newman in 1997, she said that the interaction of space, time, and movement as a three-dimensional pattern represent the person as a center of consciousness, and it varies. There's a ground of consciousness, a potential freedom, and a real freedom, and the elements of time, space, and movement are in there, and it just resonates and it varies. When natural movement is altered, space and time are also altered, and the goal of nurses is to assist individuals to identify patterns and move towards higher levels of consciousness, and this is according to Brown and Ellicott 2017 health as expanding consciousness diagram. For major concepts and philosophical underpinnings, according to Tomey and Aligo 2010, Newman's work is derived from Rogers' science of unitary human beings. Newman proposes, quote unquote, a life process pattern that focuses and understands health and illness in a new way approach in nursing. Newman's work is based on the conceptualization of wholeness, patterns in relation to space, time, and movement. And this is also under Tomey and Aligo 2010. And nurses encourage our patients, or we as nurses encourage our patients to discover their perceptions to health and their inner strength to manifest new consciousness. Now, if we move to assumptions, according to Newman's work in 2008, as cited in Tomey and Aligo 2010, page 486, the first assumption, there are basically 6, but I will enumerate one by one. The first is health encompasses conditions heretofore described as illness, or in medical terms, pathology. These pathological conditions can be considered a manifestation of the total pattern of the individual. The pattern of the individual that eventually manifests itself as pathology is primary and exists prior to structural and functional changes. Now, the removal of the pathology in itself will not change the pattern of the individual, and if becoming ill is the only way individual's pattern can manifest itself, then that is health for that person. Ultimately, health is an expansion of consciousness. Like one theorist named Endo in her work in 2017 proposed the process of caring partnership diagram as related to Newman's health as an expanding consciousness. Endo said that at the beginning of the relationship, there's an establishment of mutual process of inquiry with the client. The participants try to develop a narrative, and the researcher's goal is to listen to the client actively. In the first meeting, they invite the client and talk about meaningful events and relationship in the client's life. During the succeeding or follow-up meetings, the participants share the diagram and continue the dialogue. When the client finds future direction, the process of inquiry terminates. This transmutes to a narrative that can provide feedback for the client. Ultimately, the client benefits from this process by him or her recognizing the pattern and gaining insights from it. The sources cited on the side, and for the group 7's case scenario, as related to that care of that process of caring between the nurse and the client, we have the rest of my teammates. Thank you. Go ahead, please, Lovelyn.
Our group case scenario, Sandra, a 50-year-old lady originally from South Africa, migrated to Canada 30 years ago. She's a single mom raising her 2 daughters, a 15-year-old and a 5-year-old, after a divorce from her husband 5 years ago. She works as a full-time PSW and works part-time as a cleaning lady in a department store. Sandra is brought to the ER by a paramedic with a complaints of chest pain, nausea, shortness of breath, and fainted. She was admitted to the CCU after blood works and ECG showed a heart attack. She was further diagnosed with CAD and hypertension.
In most settings.
Hi, Sandra. I am here to give your pills and take your vital signs as well. If you need any help later, just turn on your call light as I have to keep going.
Will do, thanks.
Applying Margaret Newman's theory.
Good morning. I am Amanda, your nurse in charge of you today. How do you want to be addressed? Do you want to be called by your first name or your last name?
You can call me Sandra. I feel more comfortable with that.
Before anything else, I will give your pills and then take your vital signs. So, Sandra, how are you feeling today?
I didn't have much sleep last night.
You seem so tense. Are you anxious about something?
I'm worried after knowing that I had a heart attack. My mom passed away when I was 11 years old due to the same reason. I don't know what will happen if I am gone. I have still 2 young daughters. I couldn't rely to my ex-husband to raise them.
During the next meeting.
I feel that you are in so much stress right now. Being a single mom and the lone breadwinner is quite challenging. By the way, where are your kids staying while you're here?
They are staying in our rented apartment. I could depend on my eldest daughter to look after her younger sister. I tell you, that daughter of mine is straight A student. The younger sister excels in arts and music. She knows how to combine colors at a young age.
Wow, you're blessed to have kids like them.
Yeah, I couldn't ask for more about that I haven't been spending much time with them lately as I'm too busy working to pay bills and provide food on table. Now that I'm diagnosed with heart disease, I don't know what will happen. Maybe I will be by dead tomorrow. Who knows? Who will look after my kids? If I still live longer, how can I pay for my maintenance? So much questions lingering on my mind.
You seem you seem to have mixed emotions. Think of the brighter side. Surviving a heart attack doesn't mean you will die soon like your mom. Lifestyle modification, treatment compliance, and appropriate help are the key to recovery. If you wish, your attending physician can further discuss your diagnosis for better understanding. The in-house pharmacist can check and see if you can avail any free or discounted medication. Most importantly, I can refer you to the social service worker for further assistance, especially on financial matters. For now, I want you to get some rest, then I can come back later to discuss furthermore about your situation, and I will help find resources and solutions.
Thanks, Amanda. You are a good nurse. You gave me hope during this time of crisis. If it takes to change my patterns to get better and move forward, I'm willing to do it. Hope to see you later. Bye. The nursing process, the nursing assessment, nursing intervention, and rational goals and evaluation gonna explain by Preeti Gill. Nursing assessment. Nurses help patients understand their power and use it to develop a higher level of consciousness. Thus, it helps for them to realize the process of disease, its recovery, and its prevention. Nursing is seen as a partnership between the nurse and the patient, and both grow in the sense of higher level of consciousness. Nursing assessment continue. In Sandra case scenario, Newman theory, nurse-client relationship is characterized by a rhythmic coming together and moving apart as clients encounter disruption of their organized predictable state. Newman 99, page 228. Nursing assessment continue. Nurse Amanda built a trusted nurse-client relationship with the Sandra. Amanda used the key concept of Newman theory. The nurse worked with the client at a critical event in her life. The nurse participated with her in the process of expanding consciousness. The relationship is rhythmic and with the good timing, with the nurse letting go of the need of the direct relationship or fixed things. Newman 1999. Nursing assessment continue. Upon assessment, the nurse saw Sandra was stressed and worried about her daughters. The client knows very little about her health state and is unaware of the potential ramification of the future health difficulties. She also appeared to be preoccupied with her daughters, anxious about their living expenses, studies, and financial burden regarding the hospital's bill. Nursing intervention and rational diet modification, treatment compliance, and lifestyle changes. Proper education about concern like medication, sodium intake, and exercise program can help Sandra to live a well-controlled and healthy life. The rationale for this intervention, this nursing intervention that is based on the Newman theory, was named caring partnership in the nurse-patient relationship. The second intervention is stress management. As we saw in the case scenario, Sandra is very stressed about her current situation. Assist Sandra to reduce stress as much as possible with help of resolving her concern. Practice techniques for managing stress such as a muscle relaxation and deep breathing. Rational Newman believes that the goal of nursing is not to make people well or to prevent their getting sick, but to assist people to utilize the power that is within them as they evolve toward higher levels of consciousness. The next and important step is the social worker assistance. The social worker will help Sandra situation, whether it be financial, childcare, medical, or stress management. The rationale, this creatively uses Newman theory of the health as expanding consciousness as a caring partnership by seeking help and utilizing available resources as a nurse in nursing intervention. Nursing tips: encourage the use of good two-way communication. Helping Sandra voice her concern by communicating with her in a calm and relaxed manner allows her adequate time to express herself. It also offers compassionate encouragement. Valuation: there will be improved communication between the nurse Amanda and the client Sandra, allowing both side needs to be met. Well-controlled disease management. Advocacy and enforcement of measures like sodium restricted diet, medication, exercise, and stress management will improve Sandra health. Lifestyle change will foster change and new environment. Proper follow-up visits and communication helps to maintain up-to-date treatment plan. According to Newman, nursing is the process of recognizing the patient in relation to the environment, and it is the process of the understanding of consciousness that evolves through space and time. A person may need to experience illness to realize his and her pattern.
Group 7's conclusion as per Margaret Newman's theory of health as an expanding consciousness. We will discuss summary and we will also discuss how does this theory relate to 21st century nursing practice. Summary. According to nursing.com 2020 states, Newman's theory can be conceptualized as a grand theory of nursing. Humans cannot be divided into parts. Health is central to the theory and is seen as process of developing awareness of self and the environment. Consciousness is a manifestation of an evolving pattern of person-environment interaction. How does this theory relate to 21st century nursing practice? As a medical technology advances in the 21st century, patients have a great need of caring connection with nurses. However, nurses often cannot establish those connections because of the demands of their time and energy for a treatment-focused care. Patients and nurses will grow even in extremely difficult situations. Based on Newman's theory, a caring partnership as a nursing intervention enables nurses to identify patients' disease and helps them to finding meaning in their difficult situation and their lives. In Newman's theory, nursing is the process of recognizing the patient in relation to the environment, and it is the process of the understanding of consciousness. The nurse helps patient understand how to use the power they have within order to develop a higher level of consciousness. Therefore, it helps to realize the process of disease, its recovery, and its prevention. Nursing is seen as a partnership between the nurse and patient, and both grow in the sense of higher level of consciousness. In Group 7's case scenario, nurse helped patient to understand the process of her disease pattern and how she can recover and prevent further complications by modifying her pattern, for example, her lifestyle changes. Nurse also provide her hope to live healthy life by making her understanding of her disease process and prevention. In Newman nursing model, nursing is a caring in the human health experience. It is seen as a partnership between the nurse and the patient, with both growing in the sense of higher level of consciousness. References. Thank you from Group 7 to Miss Gail and the classmates. Thank you.